Hello, I'm Dr. Fiza Khan, an extremely informative workshop into practical insights with medical emergencies and chairside crisis. This workshop significantly improved my skills. After coming and attending this workshop, now I'm very confident about dealing with patients with various medical issues. Also, there were hands-on on oxygen administration and CPR and IM injections. After attending this workshop, I would recommend all the clinicians to attend this.
Hi, myself Dr. Meghna. Initially, there was a lecture on how to manage all the complications that we face in our clinics. Later on, there was a hands-on course and we felt very confident in dealing the things because sir has taught us very nicely and it was very informative. I suggest all of my fellow mate doctors who are here to come and attend it so that you'll have a very good confidence. If you face any of these crises, it will be very good for you to handle it with confidence.
Hi, this is Dr. Sushma. Today I had a chance to attend Mastering Chairside Crisis. Before attending this session, I literally have no idea about what are the crises we'll face during treating a patient. After coming here, I got to know that there are many medical emergencies also treating a patient, and I got to know about drugs. I also had a chance on hands-on with CPR and IM injections, and also how to operate an oxygen cylinder. Now I'm very confident if I open a clinic that how can I manage my patients.
Hi, this is Dr. Vandana Gautam. Amazing lecture, Mastering Chairside Crisis, conducted by Dr. Kanishk Srivastava. There are various other situations where we have to deal. I never would know that we can actually face such crisis in a clinic. So thanks to sir for an amazing session. And he also explained us IM injections, how to administer them, the CPR, oxygen cylinder. Doctor answered all our doubts. I'm really happy. Thank you.
Hi, my name is Dr. Yash. Today I attended the Mastering Chairside Crisis program. The reason why I attended this program is when I was in clinic, I experienced some cases like hypertensive cases, diabetic cases. I used to get panic because it was my first time to see just things like that. After completing the program, I experienced a lot of things, how to control bleeding. Dr. Kanishk sir explained it in easy language. Even after the theoretical lectures, gave us a hands-on intramuscular injection, and it was a nice program.